Getting sick is expensive, whether or not you have insurance. But the cost isn't merely a matter of dollars and cents. There's something dehumanizing about long-term health care, as if you've crossed over into a place where normal rules of communication no longer apply. If you are too sweet or a pain in the ass, nobody is going to tell you the truth, writes Emily Maloney in her memoir/essay collection Cost of Living, Henry Holt and Co., 288 pp, half out of 4. And even if you are none of these things, but just a regularly compliant patient, it's also possible they will forget to tell you that you are dying. Maloney is in a unique position to tell this story. She tried to kill herself when she was 19, swallowing 8,000 milligrams of the lithium carbonate she took for depression, and did time on a psych ward. Later, she worked as an emergency room tech drawing blood, performing EKGs and setting up suture trays. She worked in hospital billing and later for pharmaceutical companies, which helped her pay off her debts even as it sapped her soul. She could only take so many conventions with names like Digestive Disease Week and Pain Week 2019. How are Nirvana, Crystal Pepsi and Columbine related? Chuck Klosterman deconstructs the 90s. Oprah's book club latest pick is Martha Beck's The Way of Integrity. Somehow, she never seems to lapse into bleak cynicism. Even when Maloney is caustic, even when she observes and describes with a gonzo spirit, she remains sympathetic to the people caught up in the system, perhaps because she's been caught up in it herself. She can tell you how the sausage is made, and she can tell you what it tastes like. Maloney has an uncanny ability to recall and elucidate moments that couldn't have been very clear at the time. Here she is in the mental hospital. It seemed like there was a lot of hurrying up and then hours of waiting, time stretched into the early dawn. There were no windows to the outside, and the resultant effect was that of a ship, warm, snug, coursing through the strange, dark hours of the overnight shift. The lucidity here is remarkable, as is the vividness of the metaphor. Having recently tried to take her own life, Maloney is able to slow things down, to capture them in her mind, and then on paper. The double consciousness of cost of living brings to mind The Urge, Our History of Addiction by Carl Eric Fisher, who is himself an addict. But Maloney's book isn't a history so much as an inside view of the medical financial complex. As a tech, working with interns, residents, nurses, and medical students, she dissects the process and the constant specter of mortality. Considering the fate of a male patient, she notes that there is some talk in medicalese. The intern presents the case and then a statement is made by a resident, that this kind of complication is common to people in the later ends of the disease. This news stops the wife, who has been sitting there in gloves and a gown, her gloved hand pressed to her mouth. Cost of living is never less than bracingly real, whether Maloney's subject is herself or the medical field she knows as both patient and professional. The book is sure to haunt your imagination the next time you enter the labyrinthine healthcare system and face the expenses, financial and otherwise,